Hi, my name's Andrew Candela, and this is Group 9's Legal and Ethical Case Study. So, what are opioids? Opioids are narcotic medications used for pain management. Some examples of these include Vicodin, Oxycontin, and Percocets. A potential use for these medications can be for pain management after a surgical procedure. An example in the clinical setting would be a patient receiving Vicodin after having their wisdom teeth removed. In the United States, opioid abuse is becoming one of the largest issues in healthcare. So there's really two reasons why this is. One is pretty much the way the drugs work. They're very addictive drugs. They essentially reduce the sensation of the patient's pain and boost their feelings of pleasure. The second reason is the overprescribing of these medications by physicians. When we look at the perspective of the physician, there's a couple external pressures that can influence their decision-making process in these healthcare settings. One of them would be time constraints. Maybe there's an overabundance of patients per physician, and they're making poor judgments or incomplete thoughts in their efforts to try and see every patient. The second reason is the lack of pain management education. So in med school, maybe this portion of curriculum is not taught as thorough or taught long enough for students to fully grasp. The third reason is the current medical culture using pills to treat pain. So instead of a warm towel treating minor pain or massage therapy treating a patient's chronic pain, pills are being the initial response by the physician. And really all of these factors combined can contribute to the overprescription of these medications. So our case study is revolving around a patient who survived a bad car accident and is suffering from multiple leg fractures and minor rib contusions. The doctor prescribes the patient with high dosage over-the-counter pain medication due to the patient's recent history of prescription drug abuse problems. In an effort to not have the patient fall into an addiction of prescription opioid painkillers, the doctor refuses to prescribe him or her any. However, throughout the patient's recovery, he or she is still claiming to be in a tremendous amount of pain and is requesting that the doctor prescribe them something stronger. And as a group, we collectively think that the doctor should really overlook the patient's past medical history of addiction. He or she should really consider if there are any alternatives for the patient and really explore into more suitable options given this patient's situation. The physician really needs to work to keep the requests and the needs of the patient as a top priority, as the patient revolves pretty much at the center of the care plan.
Hi, my name's Amila, and I'm presenting the legal issues of our case. The first legal issue we had was medical negligence, and then the 4 elements of medical negligence is duty to care, breach of duty, injury, and causation. Duty to care, this physician's obligation is to care for his patient to the best of his ability, meaning he should have administered the medication. Breach of duty, physician ignored requests of medication and complaints of pain from the patient, Standard care was to administer the medication. Injury, patient is seen as suffering mentally and physically. Causation is without the medication, patient has a possibility of further injury to occur. And then every patient has the right to choose treatment. Patients have the right to choose the medical care they wish to receive. The physician violated patient right to choose his own treatment when he ignored requests of pain medication. Every patient has the right to receive quality care. Patient's quality of care was not based on best practices recognized by the physician. And then every patient has the right to pain management. Pain in the body's way is the body's way of alerting the patient that something is not right. Pain can often be prevented or at least better controlled with medication, which would have been the case if the physician followed protocol and administered the medication to the patient.
Hi, I'm Renee Reifenberg, and I'm presenting the ethical issues of our case study. Some ethical issues in this case study include violation of non-maleficence, violation of medical paternalism, violation of autonomy, violation of beneficence, and violation of justice. The first ethical issue is non-maleficence. Non-maleficence refers to doing the least amount of harm possible to the patient while providing treatment. How the physician in our case study did it How the physician violated this in our case study was by not properly managing the patient's condition, by not giving them the medication that they need. So the patient is suffering more pain than they necessarily have to be. What could be done differently is the physician could overlook the patient's addictive history by just giving them the medication that they need so they are not in much pain. The second ethical issue that we're looking at is medical paternalism. Medical paternalism refers to a physician making decisions for patients who are capable of making their own choices. The third ethical issue is autonomy, which is the right of a person to make one's own decisions about what is best for him or herself. How the physician violated these is by overusing medical paternalism, by standing by what they believe is right, even though the patient disagreed. Also, the patient is not abiding by the principle of autonomy because the patient has a right to make decisions about what they think is best for themselves. What could be done differently is the physician could give the patient the prescription opioid painkillers because the patient believes they need them in order to be in less pain. The next ethical issue is beneficence. Beneficence can refer to providing benefits and balancing the benefits against risks. Also, doing good, demonstrating kindness, and helping others. How the physician violated beneficence was by being more worried about the patient's addictive past rather than how he or she is feeling now, which is in a lot of pain. Physician is allowing the patient to feel more pain. What could be done differently is the physician could give the patient the painkillers to benefit them now, and they could realize that helping relieve the patient from pain now is more important than the risk of addiction later. The last ethical issue is justice. Justice involves how people are treated when their interests compete with one another. How the physician violated justice was by refusing to do what the patient wanted because what they believe was different than what they wanted. A patient is treated justly when he or she receives what is due or deserved. What could be done differently is the physician could have given the patient the painkillers because they're due the painkillers because they're in so much pain.
So for our conclusion, we decided to include a video clip of a similar case that talks about a veteran who's been suffering from PTSD.
Taking the powerful to task. Now, a Target 8 investigation.
He served his country, fought in war, but after 13 years of treatment for post-traumatic stress disorder, a therapist at the VA calls this Marine a faker. According to a local Iraqi war veteran, a VA psychologist told him he didn't suffer from PTSD, that he's only after drugs.
And that, he feels, discredits his 20 years in the Corps, as well as the physical and emotional sacrifices he made for his country. Senior investigator Steve Andrews is here with his story. And Steve, this really has shaken this vet to the core.
You know, they call this post-traumatic stress disorder for a reason, a good reason. And when veterans go looking for help, they don't need insensitive, unprofessional remarks from the VA. Serg spent 20 years in the Marine Corps, including some harrowing moments in Iraq in a bloodbath called Mosul.
You heard the mosque music come out, and then all of a sudden just sheer hell broke loose.
Peter and dozens of his buddies later became extremely ill from anti-malaria medication, then contracted the disease. He claims he still suffers side effects.
Horrible dreams. I get tremors once in a while. I have neurological problems.
The Navy diagnosed Peter with post-traumatic stress disorder. The VA treated him in New Jersey for 13 years.
My disease.
So, as you can see, to wrap this up, there's a couple differences that I'd like to talk about before pointing out the similarities of this case. One is which the patient's suffering clearly from a mental health disease rather than a physical pain like in our case study. The second difference is that we also don't know the medical history of the patient. Clearly, after suffering from a diagnosed mental health condition for the past 13 years, and there's no history of addiction in his medical history, clearly it's an assumption from the psychologist. So the legal issues that are similar in both of these cases, medical negligence, as well as the patient's right to receive quality care through pain management, whether it comes in pills, medications, or through therapy, as well as the patient's right to choose his or her treatment. As far as the ethical issues, we see violations of both non-maleficence and beneficence in both of the cases, as well as medical paternalism, autonomy, and justice. And the references are on the next slide.